care summary. Patient care summary flow sheet. So no need to document O2 sets or other specifics. Most medical diagnosis CPG goals will remain ongoing until the patient's discharge. We will be assessing for potential problems right up to the discharge, but there are times when one is complete. For example, a patient is placed on a ventilator and the ventilator is discontinued. The CPG mechanical ventilator can now be resolved. When the problem is no longer applicable and you want to resolve it, first highlight at the goal and click on resolve.
So that means that y'all through with it. So you would click on resolve to make sure that you document that we're done with this. We don't need to document this every day. So take it off your list of things to do.
Right.
So it takes it off your list of things to do. I'm trying to work on the way I speak because I find that I say things a lot that's kind of ghetto-ish.
Oh no, you can't be too ghetto. She came on here, shit. But we got a nurse that she was new when she first came here, real sweet, down. She Frida. She is so fucking Mac and B She she is Mac straight up Mac and fucking B She was an MHA in a nursing home, and she wanted to go to school. Well, her son, she ain't never said it, but I know he was probably in drugs. He said, "Mama, go ahead. I'll help you. I'll help you." So I guess he was helping her financially, but he was murdered.
Oh.
And it was probably a few years ago. Yeah. She never. She said he was killed. She never said how. No specifics. So we just figured he was probably in drugs. That's just me. Nobody ever discussed it, and we don't want to discuss it. I just.
Yeah.
Okay. Resolving CPGs, which puts green check marks next to goals and grays out the section. Two visible reminders indicating that the goal is complete. So remember that because I think that's going to come test. Did you get it? Did you get what I said?
I'm
No.
texting.
I'm telling you, you gotta help me do these tests. I know it's going to test.
Okay. Which puts green check marks next to goals and grays out the section to visually remind. Okay. So if it's grayed out and it had a green check mark on it, that means it's complete. And it's.
If the patient should relapse and need to be reintubated, the CPG can be reactivated by choosing reactivate then accept on the screen, which opens.
It reopens it. Okay.
When a patient is discharged, we will resolve all CPGs even if the outcomes are not achieved. This is done similarly to how we resolve one, but we can do them all at once. It is important that we remember to resolve them as they will stay on the plan of care even at the next admission. Did you get that? That's very important. We have to put, we will resolve them even if the outcomes are not achieved. Put resolve. We got to do that.
We do that now with our care plans. We go around and put med on everything, even though they're not.
Resolving a discharge. To resolve a number at one time, choose resolve problems in toolbar. In Epic, thanks to the addition of CPGs, patient education is very closely tied to our critical thinking and analysis of a patient's assessment data. When a CPG is added to the plan of care, education points are added to the patient's education record, making the education record truly reflective of the patient's condition.
Okay.
CPGs added to a plan of care link our patient assessment to our education plan. CPGs added a patient education link to our assessment. CPGs added to a plan of care link our patient assessment.
Okay, CPGs added to a plan of care. So what does the CPG stand for? Client, patient goals or client
something like that.
Purpose and goals or something. Okay.
Patient care goals.
Okay, so patient care goals added to a plan of care.
I got the P first. It's CPG, not PCG. CPG. Okay.
So the goals added to a patient care link link the patient assessment to the education plan.
Okay.
So like if you assess,
okay. That makes sense. I was reading it wrong. The alignment of the assessment, goals, interventions, and education demonstrates our critical thinking and professional accountability. Okay, this is it. In the new EPIC system, we will have one plan of care, the patient plan of care documented on by all disciplines. Each discipline will document according to their own scope of practice. A plan is reviewed every shift or at transfer or a change in the patient status. Did you get that?
Mm-hmm.
Every shift or a transfer or if the patient's status changes.
Mm-hmm.
Evaluate each patient and do a summary statement, which will go to the notes section of the chart. Evaluate each patient, then do a summary statement, which will go to the notes section of the chart under care plan notes. Get that? I think that's going to be on the test. This short overall summary of where does that statement go? Go to the notes section of the chart under care plan. That's simple. We know that. Okay. This short overall summary of the patient's progress will give all disciplines a quick look at the patient's progress. And if they need details, they can look in the flow sheet. Patient education is clearly linked to our assessment and our plan of care and is the responsibility of all professionals involved on patient care. That's it. Now what do we do? There's no place to click on.
So 53 out of 53, hit the X button and see if it takes you to a test.
What X button? Oh.
The one that's sitting on the red background, red X on red background. Yep, click here to take the test. You called that one.
Really?
Yeah, it said click here to take the test.
Motherfucker.
No, it said click here to begin, so that take you back to the thing. You have previously been in this lesson.
Say what? Cancel? Do cancel?
Yeah. Okay, exit. Okay, you ready?
Click here to take the test.
Uh-huh.
You gotta help me.
Okay.
Lord.
All right. Human response.
And I'm gonna write the answers down, Frida. So when you do your test at home.
So CPG means.
Cause you can do your test.
Uh-huh.
From here, can't you?
Uh-huh.
Okay, we're gonna write the answers down.
Okay. Human response clinical practice guidelines. So clinical practice guidelines is the CPG.
Okay. Have an added component of the initiator of the CPG identifying the signs and symptoms and risk factors which show alignment of the patient to that CPG. Is that true or false?
True.
Human response clinical guidelines have an added component. Okay, we're going to put true. Number 1 is true. Let me find out. Number 2, true. Okay, number 2. Which of the following is true about plan of care summary statements? They are short 1-2 sentence statement giving a high level look at the patient's current progress toward goals. They describe all the interventions we did to assess the patient to reach his goals.
I think they did 1-2 sentence statements giving a high level look. And then, because that's the part that get added to the notes.
Okay,
so they're not
going to say 2 is
well, you know when you they mix up the questions.
Okay, but we'll try to remember. Okay, so we should write the question down.
Huh?
We should write the question down.
Yeah.
Human was CPG. Fuck it. CPGs have an added component.
You must answer 0% correctly.
Huh?
Whoa. Look at the thing. This examination contains 10 questions. You must answer 0% correctly to pass examination. So no matter what score you get, you passing.
Oh, really?
Look at it. You must answer 0% correctly out of 0 out of 10 in order to pass this examination.
Oh, yeah?
So no matter what you put, you pass it because you just got to answer some of them correct. I mean, none correctly, really.
Okay, how much of this do we write so we know which question it is?
Like the first three words.
Use added component of the initiator. Okay, that's good enough. And we put true. Okay, number two is what which is true about the
Which of the following is true about POC statement?
About
POC statement.
Plan.
I'm about to say you don't have to write plan of care because that's POC.
Statement. Okay.
They are short, and just put they are short.
They are